Hey, good to see you. Process improvement today. Here we go. You ready? This is where it all comes together. This is where all of that pre leadership work of really getting clear of where it is you're going, of being so confident, so authentic, knowing how much influence you have in your world. You're seeing systems and structures as support, and you are doing this authentically to you. You're leading, which means that you have awareness for what's going on around you. You take it all in the political climate in healthcare, in research, in your field, in your town, your community. You're aware what's happening in national, international politics. You're aware what's happening in your clinic with your people, with their lives. You're aware of what's happening at the corporate level if you've chosen to house in corporate. You're aware of what's happening in the financial institutions that you've chosen to partner with, whether those are health insurance companies or some of the investment training companies that you're working with. You're aware of your staff, their families, what they're feeling, what they're thinking. You're aware of your patients, what trends are happening there. You are aware of what times of the year things are going on. You're aware of new treatments. You're aware of you being sure to be aware of what you're feeling, what you're desiring, and really staying aligned with that. Hey, this alignment piece, this process improvement piece is how we take all of this inner work that we've done and we align our outer world to it. So it takes this awareness of what's happening. It takes awareness of what you want to be happening, what you're seeing, what you're loving, what you're not loving, what's fitting that dream, that desire, right? You did the pre work to feel safe enough to even dream your dream and believe that it could happen. You're leading by example. You are doing it. You're doing it in your exam lanes, in your surgery suites. You're doing it talking with your people. You're doing it talking with your patients. You're doing it as you're approving letters to go out or emails to go out. You're doing it when you speak to your staff. You're training your team, not only on the technical skills and the technical components, but also what you want it to feel like. We're going to come back to training your team because this is a big part of the process improvement. Empower, encourage. Hey, this is our goal. This is where we're going. This is what we want it to feel like. This is what I'm seeing. This might be a restriction spot. This might be a spot that things are kind of getting caught up in. What's a way that we can make this flow easier? And asking your staff, delegating. You now know that you are so grateful for your staff because they support you. They are the resources that you have called in to bring the skill sets that they have and the strengths and the ideas that they have into your awareness. So you want to speak to them. You want to get their opinions, okay? You're encouraging them. You're celebrating them. Yes, that's exactly how we want that done. Yes, that's exactly what that gets to look like. Hell yeah, we just had that day. Yes, this is how this gets to go. And then we redirect back to that, right? That's leadership. Awareness, lead by example, train your team, empower, encourage, and redirect. That's the 6 arcs. That's what makes up leadership, okay? So, process improvement from the moment people miss so many of these moments. So, I'm going to stress this from the moment that a person, your patient, your client first touches your business. They look it up on the web, somebody refers them, whether it's another provider or a colleague, a friend, a networking someone, that they get referred to you. And then they call your clinic, your hospital, your practice, your center. They get there, they wait in the waiting room, they do their check-in paperwork, and then they have a technician or an MA or a nurse, and maybe they have some testing, some pre-testing, some getting them ready. Maybe it's vitals, maybe it's reading an eye chart, maybe they go through what's on their med list with someone, whoever that person is, whatever that experience is like. This is the EMR that you set up that's going to guide how this flow goes. When they see you, do you have a scribe who's helping with some of that? When they check out, when they call you with questions, when they need to refill a prescription, who's the patient educator? Who's the surgery coordinator? Who's billing? Now, if your technicians and your nurses and your MAs are not BFFs with the billing department, we have opportunity. If you're not seeing this as a whole, we have opportunity. Now, here's the thing that I see a lot of people that have done is they have chosen to house their practice in a corporate system. And they go, oh, I gave up all control over that. The first foundation that we develop when you work with me is realizing just how influential you are in your own world. And then we learn to see structures and systems as support, not constriction. Okay? So, taking that power back, taking those options back, taking back the question, not I can't do that. I don't have anything to do with that. I can't do anything about that. That's where we burn out, right? Is when there's so many things that you care about that you think that you can't care about. And you bring that back. What can I do? What options do I have? Who can I speak to? What flexibility is there within their systems? Is there an on-site scheduler that you can have a conversation with, that you can celebrate? That you can say, hey, I'm seeing this. Can we do this better here? Who can you partner with? Who can you build those relationships where you're cherished, loved, and respected, where you can partner with somebody there, even if they're an employee of a national system? How can your sphere of influence, right? Yes, I'm spiral coaching and consulting. And yes, what we do within grows to those around us and grows to those around us. But we also, in Light Leadership, in my program I do twice a year, we talk about your immediate sphere of influence, right? Yes, you're going to impact something like 64 million patients over the course of your career right now. What's one conversation in that sphere of the people that you can connect with one conversation that you can have to help your practice feel more the way you want your practice to feel? Is there a call center that you can be on the board to help, right? On the advisory committee? What's one way? What's one person that you can help this happen? Okay. Who are the IT people? Who are your, oh my gosh, there's a word, intermediaries that are going through, that are the clinical connections to, there's a lot of opportunity in websites, you guys. Is mine perfect? No. And in healthcare, so many of these are just cookie cutter websites. Make them yours. Right. Yes, a lot of energy is going into social media, and that's really important too, for them to get to know you, get to know what's important to you, get to know where your focuses are. But also, when they come to check you out, when they come to look at their new patient paperwork, when they come to book an appointment, When they come to look up your phone number to call you, they're still going to see your website. And so don't forget those. I see so many that haven't been updated since 2018. Or is it expensive? Maybe, but it doesn't have to be. So what parts of that can you update? All right, well, that's a national platform. I can't do anything about that. I don't believe that's true. You have more influence than you realize. Who can you talk to? What committees can you get on? Now, here's one of the things coding, the level of complexity that you can code has to do with the notes that are taken, the level of decision making that's done, but your documentation, we know this from prior authorizations now, but also your coding has to do with your documentation. And so if your MAs, your nurses, your technicians are not documenting the things, then you can't code certain levels. You can't code some of these higher level things if the chief complaint isn't set up, or the secondary complaint or the tertiary complaint isn't set up and organized in a way that then the doctor's documentation or the healthcare provider or your documentation partners with. So making sure that from the very beginning, from the way the exam is scheduled to what they're taken back for, that your staff is listening to actually what's going on with the patient and has understanding of this coding. Like I said, your nursing director, your clinical lead, they need to be hanging out with your billing people. A monthly lunch would not be too much. Okay. Probably not enough. That is required. Okay. This goes back to that training piece. I said I was going to go back to training. Training then is where you say, hey, this is our goal. This is how we want it to feel. This is the desire. Yes. Your paperwork, your forms, the way you speak to it, the way it's spoken about in the entire practice from start to end is the same. There's a flow. Now, it's okay to say, hey, these are the corporate forms. This isn't maybe how I would set it up. I would set it up like this. Here's what we got. Maybe in your practice, you add a supplementary form. Maybe you have a discussion the way that, because there's a form, but the way that your people explain what's on the form for pre-op or for this diagnostic test, how you get ready for it. Hey, this is really important. The doctor's really looking at some particular things. We want to make sure that you're set up that you get the best test possible. So, hey, this technology, the doctor really believes in this technology. I'm so glad you guys had a great opportunity to speak about this option for you. He really believes in that. That's great. I hear you speaking that this is important to you. Ugh, what a great pairing. Great idea. I'm so glad you're doing this. This is awesome. So let's get you set up to do that. So because this is whatever, then we really want to make sure to do this exactly right. So let's talk about how this works for you, how this looks for you, what parts of this are realistic. Let's get this scheduled in a way that this works in your life. Do you have your calendar? There are ways that things can be said. There are This is the stuff that I talk about training. Yeah, you're going to train the clinical skills. Yeah, these are the forms that we need going into surgery. Yeah, these are the forms that we need for this treatment. But so many times you see people just getting, here, sign that. What? So if you have somebody kind of walk them through it, Even if it's the corporate form, the way that they speak to it supports what you're saying. Okay. It supports the feel that you want in the practice, the relationship that you want to foster with your people. And this is stuff that we get to train on. Be available to your people. They are the ones supporting you doing the work that you want to do. Then you're going to look at the flow. Hey, this is our goal. This is where we're headed. This is how we want it to feel. This is the clear vision. Does this piece fit that? Does this piece fit that? How can we more align this piece to that? You have to have that clear goal first, that clear how you want it to feel. So I have everything from guided meditations and visualizations to help you with that, to workshops to help you with that. I do trainings to help you with that. My initial program helps you with that. There's an option for VIP intensive in-person days, okay, to help get this vision clear. Because then once you do that, the rest of this kind of falls into place, okay? Another example, really quick. I had a provider that was doing the testing for both eyes, right? So that's your technical component of the coding. In between the two things, right? It was a right left thing again. He was not coding for re-evaluating. A modifier wasn't being done by the coding team. They went back and rebuild this decision-making process that the provider was doing. It was $250,000. You guys, this is 10, 20 years ago. This stuff, looking at it, partnering your clinical team and your billing team, patients that get told to expect whatever. I know you have to do these estimates. I know insurances do crazy shit. But then what's the situation for them contacting you to get questions answered, to get things resolved, to understand why it's different? I recently had a treatment where where I was given the estimate that it would be XYZ dollars. And then I got the bill at the end and it was double that. Now, we're fortunate to have good insurance and the resources, but why? Cool. Why? I had even offered this. Hey, there was one thing that we were going to for sure do. And then when they got in there, we were going to maybe also do this. Was it because the estimate had been done for one and then he ended up doing both? I don't know. So it was 6 weeks and phone call after phone call and phone call and phone call. Later, like I said, escalated to VIP levels within this healthcare system to get the answer that, yes, indeed, that's what it was. Cool. I'll pay you right now. I just wanted to know. I had another one recently where I had been estimated at 0 out of pocket, which didn't make sense when I read my insurance, but I'm fortunate. I'm in this world. I'm able to read more. And then the way it came up coded was a bill for $2,900. Now, I could look at that and say, hey, like they missed a pre-auth or a code wasn't submitted or something like that. I know that, but people don't know that. And so if a patient then has been told $0 and gets a bill for 2,900, it took me 5 months to get that resolved. 5 months. And I can't tell you how many phone calls. I can't tell you how many messages were left, how many phone calls there were, how many people I talked to, how many. Well, I don't know. So you got to talk to this person. Okay. And then I'd talk to that person, or then I'd leave a message for that person. Then I'd leave another message for that person. And then they're going to email that person. And then, oh my word, patients cannot have to go through that. They will not refer back to you. Now, it's really sad because these were incredible providers. And as providers, you have influence on how this goes. You can help this. This is stuff you can do. Help that process, hey, this is important. Like, I want to continue treatment with them, but I'm not going to go through that again. I love the provider. Am I going to go back there? Probably not. Process improvement matters from the beginning to the end. Now, once you've done your pre leadership work with me, I pick a few clinics a year, a few providers that I've gotten to know, and I will come to your practice and help with this process improvement. Now, I'm so confident that what we're going to do is not only going to make it more fun for you, reduce stress for you, your staff retention is going to go up, your patient satisfaction is going to go up, and dollars go up. And I'm so confident in that, that if you do what I say you're going to do, that money goes up, revenue goes up. That I have structured the way that I have you paid for this, that it's less on the front end and a portion of the profit, a small portion of the profits over time, because I know that adds up. Okay. This process improvement, this is where it gets real. This is where creating those systems and structures to support you shows up. I want to be able to talk to you, get your clear vision, know what you're doing, know what you love, know who you are, know what's important to you. And then we can streamline this and align this toward your goals. Leadership is empowering and unifying your staff, your team toward your common goal. But to do that, you have to have this set, clear vision. So start there. Let me know how I can help you. I'll see you soon.